Welcome to Zoom In, Zoom Out, your in-depth look at news from around the world. I'm Rik Glauert. It's been nearly 2 months since Hamas militants stormed across the Gaza border with Israel, killing 1,200 people and taking hundreds hostage. The brazen attack shook the country and plunged the region into escalating violence. As Israel wages war on Hamas militants, Palestinian civilians are bearing the brunt of the conflict. More than 15,000 have been killed across the enclave. Israeli forces have now intensified their ground offensive in southern Gaza after a short truce, while the UN continues to urge the military to protect civilians and alleviate the humanitarian catastrophe. For more on what's happening on the ground in this crisis, I spoke to Dr. Shang Kai Hung. He's an emergency doctor and international mobile staff with Doctors Without Borders, also known as MSF. We began our conversation with him detailing his mission to Palestine.
Since the July of this year, I stayed in the Gaza City, which is a little bit north and middle part of Gaza Strip, and just next to Shifa Hospital. If the audience have the ideas about Shifa Hospital, it's one of the biggest hospital which is also under attack during this war, and we just stay next to it. But for me, I work in another hospital. It's more north in Gaza Strip. It's named an Indonesian hospital. So as an emergency physician, I worked in this hospital every day with the doctors there. And the major objective of my mission is we try to improve the emergency health system there. Because the conflict between in this area is not just this time. It happened for hundreds of years. So in Gaza Strips, they have escalation or war every few months or years. So the people in Gaza, they really rely on the emergency department or emergency services. So even without war, the emergency department is super overcrowded. So we saw a lot of vulnerable group, including regarding as the geriatric patients and the children's. So yeah, so this is the population I treated in hospital.
Can you tell us a bit about what you saw in terms of the Palestinian people in the Gaza Strip, in terms of their medical needs? What sort of situations were you seeing from the people there?
I have to say it's a tragedy. I left Gaza for about 1 month, so I think the situation now is even worse. But even only the first or the second week of the outbreak of the war, there's almost no any medications. We need to suture the patient without any local anesthesias because we run out of the medication. So we have 2 children. They are older sisters and younger brothers. Their house was bombed. So all of the other families are died. And they are no more than 10-year-old. And both of them need amputation because the injury of the limbs. But we run out of the local anesthesias. So we have to do the operation for both of them. And the older sister, she has to hold his younger brothers and to receive the operation, and she needs to witness all of the process, and she will be the next one. I mean, it's this kind of suffering or pain, it's unnecessary for us. We can do more to prevent this kind of tragedy.
How did you feel seeing these types of situations? Had you witnessed this kind of thing before?
No, as an emergency doctor, I work in a big hospital in Taiwan. So yes, I've seen a lot of critical patients, severe injured patients. But in this scale, this kind of numbers, and especially we know we can do better, but we are run out of the resources. We have no capacity. We have no electricity. We have no gauze medications. So I mean, this kind of experience makes me more frustrated. We can do more, but we cannot in reality. As an emergency physician, when we faced a patient inside the hospital, the first thing is not the very emotional reaction, but is that how we evaluate or treat a patient. During the conflict, I have no time and I have to hide my emotion because I have to deal with the situation. So actually not. But after I left and I come back to Taiwan, I started to digest the process.
And how difficult was it for you to do your job, given that that was it still is an active war zone? How did you go about keeping yourself safe whilst you tried to help other people in Gaza?
MSF has our own security regulation, so we still try our best to keep us safe. But I have to say, it is because our Palestinian staffs, even though they are also affected by this conflict, they are also the refugees. They have to take care of their own families, their own children, but they still come to us and take care of us during my stay in Gaza. So I think it's the most important part for me to safely stay and live Gaza.
Did your experience in Gaza make you realize how important the work that you do is? Did it reaffirm your dedication to being an emergency doctor?
After the war, most of the foreigners, they cannot reach the health facility. Only few of us can go into the clinic or the hospital. It's not important for us to emphasize that how big things we have done, but only stand there and the Palestinian or the Gazans, they know there's other people from outside stand with them. It's very important to them.
Why did you leave Gaza and how did you get out?
Because the wars become very severe in intensity. So during the second week of the war, Israelis ask every foreigners need to go out of Gaza. But we stayed inside of Gaza for 26 days until the 1st of November, the opening of the Rafah crossing. So we moved from the north part to the south part, and we moved from one place to another. And these 26 days, we tried our best to provide some medical assistance also. And fortunately, luckily, I evacuated on the 1st of November.
We're going to zoom out a bit and look at the situation beyond your work in Gaza. Since you've got back and you've been talking to media here in Taiwan, you've called for a ceasefire. There was a pause, a truce between Israel and Gaza, and that's now collapsed. Can you tell us why you were calling for a ceasefire?
From the perspective of a doctor or from the perspective of a medical humanitarian organization, it's nonsense that we stay in the hospital and we tried our best to save 1 or 5 or 10 lives, to do our best to save them. But at the same time, the war is still happening and thousands of people are still dying. I think it's unacceptable and it's nonsense for a doctor. So I think the ceasefire is essential and must to be done now.
And one thing we've been hearing from reports of Gaza is the Israeli attacks on hospitals. Can you tell us what you know about these?
Since the start of the war, according to the statistics of WHO, it's over 100 accidents of attacking the medical facility. The argument or the problem is not it happens or not. The argument on this issue is the necessity or the legitimacy of attacking the medical facility. For me, I have no knowledge or no ability to judge this is correct or wrong by individual cases, but I can raise the one accident. MSF, we have our own medical facility in a hospital called Al-Auda. It's in north part of Gaza. And on 21st of November, this place was also attacked. And 4 of our staff are died from this accident. Even before the attack, they are doing the operation, they are treating the patients inside of the hospital. So I have no any idea, and I cannot think of any reason why this place, the international neutral organization, independently operated medical facility will be targeted. The feeling is very bad because we know that even during the war, there's some regulation. Every side, every party needs to follow or need to obey. This place should be only for patients and medical staff, and this place should never be a target.
Have any of the people you worked with, your colleagues or your friends from MSF or other doctors or medical professionals in Gaza, have they been affected by these attacks?
Yes, one of my colleagues worked in the Indonesian hospital in the first day of the war. This place received the airstrike. So one of our nurse was died from the accident. And we just worked together a few days before the accident. And his name is Muhammad. He's a very positive and a very good guy. We are close because not every nurse in Gaza they can speak fluent English, and he could. So we just had a good relationship there. So yeah, it's only the first day of the war, and for MSF, we have 3 staff also died from this war, and most of our Palestinian staff, they lost their friend, their family, their houses, and it's still happening now.
Despite the risks, MSF is still sending doctors and medical professionals into Gaza to help people. Could you tell us a little bit about what the next phase of their mission is likely to be, and what they can do to help, given that the situation there is, like, as you said, only getting more dangerous, more volatile?
MSF has been working in Palestinian for over 30 years, and we has over 300 Palestinian staff. And before the war, we have 22 foreigner staff there. But because of the war, we are forced to evacuate from Gaza. But there's another team composed by emergency physicians, surgeons, and intensive doctors and nurses. They have already get into Gaza on 16th of November. And they work in the south part of Gaza. They work in the hospital. And mostly we work on the patients suffer from trauma and suffer from the burn injury, because these 2 population, we have a lot of this population during the war. So yes, they are still try their best and work with our local staff to provide the essential medical assistance there inside Gaza.
And what about you? Do you have any plans to go back into Gaza with MSF? Would you like to go back there and help?
Yeah, before the war, my schedule is to stay for 6 months. So, but I left on the 4th month. So yeah, my local staff also asked me the same question. But I think the if I say yes, it's kind of unresponsible, because it's easy answer. So I just answered that I have to go back to finish my mission. But yeah, I don't know when, but I really want to do that.
There's obviously a lot of talk around this conflict. We see it in the news. But what would you say to people, to our audience, everyday people, and to world leaders? What would be your message to them about helping people in a situation like in Gaza?
For audience, I have to say to keep notice this accident and don't forget it is the most important, because the most saddest things that if the international society of the public forget this tragedy and it's still happening, is the saddest thing for them. And for the bigger one, I think the appeals from the MSF is very clear. The first one, we ask for ceasefire, because it's enough. We cannot have more injured, more deaths because of the war. And second one, we also ask there should be enough and sustainable humanitarian aid to bring into Gaza, because it's not only for doctors and nurses can save the patients. We need the resources. And the third one, we need to emphasize again that hospital facilities and the medical staff should never be a target.
Dr. Hung, thank you very much for joining us and sharing your experiences from Gaza.
Thank you, Rik.
This has been Zoom In, Zoom Out. For more stories from TaiwanPlus News, download the TaiwanPlus app or visit our website. Thank you for watching, and we'll see you next time.
I'm Rik Glauert in Tokyo, and you're watching TaiwanPlus News, the voice of freedom in Asia.